So today I'm going to talk through how to use the Accupap for positive airway pressure therapy. Accupap is the type of positive airway pressure therapy that my facility uses for lung expansion therapy. It's a little bit different than an EasyPap because you don't actually need a manometer or a pressure gauge because you actually just dial the pressure in on the top of the device. So this is a device that you would use to help reverse atelectasis, to help reduce air trapping in COPD or asthma patients, as well as to help optimize bronchodilator treatment for those patients. So I am not allowed to take this device out of the packaging because they are too expensive. So I'm just going to kind of show it to you and try to explain it to you in the plastic. So this is the Accupap device, and so what you do is you take this hose and you hook it up to the flow meter at 10 liters per minute, and you attach it right here to the inlet. And this is where you're going to dial your pressure. So you have from 5 to 20 centimeters of water pressure that you can actually dial in, which is going to give your patient a pretty much consistent flow, and then, or consistent amount of resistance. And then this is the mouthpiece, and they also do have a mask and a trach mask that can be used with this device. So you would just hook that up to the flow meter, and then you would instruct your patient to just breathe normally. Because they're already getting that set amount of pressure, you don't actually have to use that pressure gauge. You can hook one up if you want to. Right here there is a little place to hook a pressure gauge up there. So you could also add in a bronchodilator treatment and a nebulization. You would take out the mouthpiece, and then you would insert the corrugated tubing right into this piece, and then you would just elongate it. So your neb cup would be like down here, and then the mouthpiece. So it just makes it a little bit of a longer apparatus, but you could do that also if you wanted to. So then, of course, before you do your treatment, you're going to check your physician's orders, and you're going to do a general assessment of your patient, as well as vitals, SpO2, and breath sounds, and you will repeat that when you're done with your treatment as well. If your patient ever shows any signs of distress, you need to stop what you're doing, stay with that patient, and stabilize them as well.